Well, I've always wanted to be a dentist, like Hermie. I ended up in dental school when I was 19, and by the time I was out at 23, then I went to the military for 2 years, and I was captain there in New Jersey as a dentist. So during that January of 1968, 6 months into my residency, I knew I wanted to be in Southwest Minneapolis for my practice. So I rented space from a general dentist in Southdale Medical Building on Saturdays to get started. And that's how we started the practice in this area. Subsequently, my classmate of mine, Dave King, who was not a relative, went into pediatric dentistry as well. And so we were partners for 2 years while he got his PhD. And we had a little 2-chair practice in Southdale Medical Building. Incidentally, his mother was a dentist at Cambridge State Hospital. So as sophomores in dental school, we were going to Cambridge State Hospital to treat and see the patients from there. And at that time, we had about 3,000 residents. So that was where my love of the special needs came from, was through my partner's mother, who was a dentist at the state institution. So I've always had a heart for the special needs kids. And when I went into the program, there was only 3 other pediatric dentists in Minnesota, one in Rochester, one in Minneapolis, and one in Golden Valley. So that's why I wanted to come down to this area. So we'd meet and talk about problems and how we get going. And so then when I was teaching at the U, I was head of the dental department at the University of Minnesota Hospitals. Children's Hospital came and asked us to have input into their dental clinic when they were building it. So I ended up running the dental department at Children's for 8 years, and then had several very wonderful partners associated with me at that time. And but all in all, we kept expanding our Edina practice. And we moved into the new building and got 5 chairs into Southdale Medical. And then we decided to go out to Prior Lake and rent space there. And we had some more partners that came in, and then moved into their Burnsville office. And then when another pediatric dentist in Eden Prairie, we approached him about combining our practices, so then we ended up with the Minnetonka at Children's West. So I grew from a rental of a 1-chair general dentist on Saturdays to three offices with multiple chairs. And I think the beauty of it has been the association of wonderful people, partners, wonderful people, assistants and front desk people. Our goal is to whatever's best for the child is how we run the practice. We want the best for whatever the child needs, and that's been the basis of the practice since day one. It isn't about us, it's about what's good for the kids. The wonderful thing that I saw was seeing second generation, So we figured we were doing a good job because they'd bring their kids in later. And I still go to Byerly's or go to Target or go around, and I always see people that I know. The stories about moms driving by the building and say, "That's my dentist, can we stop?" And I say, come on in, get your price. Retired after 52 years and enjoyed every minute of it. So I never had to go to work, I got to go to work. And that was a mentality that we had.
Well, I had an interest in the medical field. I really didn't know till I was in college whether I wanted to go into medical school or dental school. I had some mentors when I was in dental school who directed me toward pediatric dentistry. I completed my residency at Milwaukee Children's Hospital. We were exposed there to a large number of children with disabilities as well, and so working with Kurt was a good fit for me because of his interest in providing care to those who were disabled. And I've enjoyed that throughout my career as well. I joined the staff at Minneapolis Children's Hospital, met Dr. King. He enticed me to come with him and work with the residents and the patients at Minneapolis Children's Hospital. Began to work also with Dr. King in the private practice in Edina. And the rest is history. I started with Dr. King in 1976, and I left the practice in 2014. So I did not have as long a career as Dr. King, but I had a very enjoyable one.
Over half of the adult population doesn't want to go to the dentist because they're frightened. And I don't think that the kids that graduate from our practice are in that 50%. I think that they've learned that dentistry can be comfortable and can be accepting of what needs to be done for their betterment. So that was another goal that we had, as the kids would leave the practice knowing how to prevent dental disease and to be able to go and not have the fear that a lot of adults have. So.
You got a cat here on you?
Oh, yeah, of course.
Who doesn't?
Who has a
When you
cat?
live with cats.
Yeah.